Assalamu alaikum and hi. In today's video, we are going to discuss about comparison between loading dose and maintenance dose. So let's start the video. Definitions. A loading dose. A loading dose is an initial higher dose of a medication given at the beginning of treatment to rapidly achieve a therapeutic level in the bloodstream or tissue. Its purpose is to quickly establish the desired drug concentration. Maintenance dose. A maintenance dose is the ongoing dose of a medication administered at a regular interval to maintain the desired therapeutic effects once the drug has reached its steady state concentration. देखो लोडिंग डोज में क्या है एक इनिशियल हायर डोज है जो कि हम किसी भी ट्रीटमेंट के बिगिनिंग में देते हैं ताकि हमारे पास इसका पर्पस क्या है to quickly establish the desired drug concentration in bloodstream. मेंटेनेंस डोज में क्या है ये हम एक ongoing ट्रीटमेंट में देते हैं इसका पर्पस क्या है to maintain or to reach its steady state concentration quickly and fastly. Timing. Loading dose. Loading dose are typically administered as a single or series of higher initial doses at the start of a treatment or when a rapid onset affection is desired. Rapid onset affection is desired and start of treatment is the timing of loading dose. Maintenance dose. Maintenance dose are administered regularly after the loading dose to sustain the therapeutic drug level in the body over time. Maintenance dose will maintain the therapeutic or sustain the therapeutic drug concentration in the body for longer period of time. Purpose. The primary purpose of a loading dose is to rapidly achieve therapeutic drug level, especially when immediate therapeutic effects are needed or when drugs have a long half-life and take time to reach steady state concentration. So remember that loading dose will be helpful in those drugs having a long half-life. Maintenance dose. Maintenance dose are aimed at maintaining therapeutic drug concentration within the desired range over the duration of treatment. They compensate for drug elimination and maintain a steady state concentration. Dosage. A loading dose are typically higher than maintenance dose to achieve therapeutic concentrations quickly. The specific dosage of the loading dose is often calculated based on pharmacokinetic parameters such as volume of distribution and clearance rate. Remember that loading dose depend on volume of distribution and clearance rate. Maintenance dose. Maintenance dose are aimed at maintaining therapeutic drug concentration within the desired range over the duration of treatment. They compensate for drug elimination and maintain a steady state concentration. Frequency. Loading dose. Loading dose are administered infrequently, often a single dose or a few doses over a short period, such as within hour or days. So this is the frequency of loading dose. Maintenance dose. Maintenance doses are administered regularly at predetermined intervals, such as once daily, twice daily, or at other specified frequencies, depending on the drug pharmacokinetics and therapeutic regimes. Clinically, loading dose are commonly used in acute situation. Remember that loading dose will be used in acute situation where rapid therapeutic effects are needed, such as in the treatment of acute pain, acute infection, or drug anesthesia induction. Very important to remember. Maintenance dose. Maintenance doses are used to sustain therapeutic drug level for chronic condition or long-term treatment, such as in the management of chronic disease like hypertension, diabetes, or epilepsy. Examples: when administering digoxin for the treatment of atrial fibrillation with rapid ventricular response, a loading dose may be given initially to achieve therapeutic plasma level quickly. So remember this concept. Maintenance dose. After the loading dose of digoxin, a maintenance dose would be prescribed to sustain therapeutic level and control heart rate over period of time. So this is important to consider. Summary. In summary, loading dose and maintenance dose serve distinct purpose in drug therapy. What are their purposes? I already explained it. Loading dose are administered initially to rapidly achieve therapeutic concentration, where maintenance dose are given regularly to sustain therapeutic level over time. Understanding the difference between these dosage strategies is essential for safe and effective medication management. So that's all. Thank you so much for your attention. If you learned something valuable from this video, please give me a favor, like this video, subscribe this channel, and share this video with your friend. Thank you so much for watching.